Let me talk a little bit about eczema and some of the protocols that might help. And also, if you have psoriasis, this same protocol will be helpful. However, remember, psoriasis is an autoimmune disease, kind of a much more deep-seated disorder than eczema, but the nutrients will help in both cases. The first things we like to use, we like to look at the omega-3 fats, because the omega-3 fats are very anti-inflammatory. They directly help to heal the tissue, particularly the skin tissue. We know that an ideal dose is probably 3,000 milligrams of EPA and DHA. Omega-3 fats are very important. We know, of course, that the probiotics are helpful because they begin to heal the gut, and we know that the gut controls so much of our inflammatory response. Eczema and psoriasis are both inflammatory responses. And also vitamin D. It's been long known that vitamin D can help correct skin conditions. And certainly, vitamin D is essential for autoimmunity, for protecting from and recovering from autoimmunity. Zinc, of course, is another nutrient that's been studied to help with eczema, as well as quercetin. It's interesting that quercetin appears on many of these anti-inflammatory programs because it is such a strong antioxidant and anti-inflammatory. And we at Alkaline for Life have a unique form of quercetin, high-potency quercetin dehydrate combined with OPC, which gives you a especially big anti-inflammatory benefit. Don't forget to be very careful to check for any foods you might be reacting to. Look at my 10 steps to stronger digestion. Develop some good eating habits. Avoid things you're sensitive to. And give these nutrients a try for eczema and even for psoriasis. If you want more information, just type in skin and we'll send you the protocols.